Thank you. Good evening, everybody. So shortly after we finish up these presentations, many of us will go out there and continue the reception. So I ask you to imagine walking into the reception room, and you might see a table laden with some delicious-looking hors d'oeuvres. So then you have some decisions to make. So will you have the mushroom tart, or maybe the hamburger slider, or maybe you should go for the vegetables? So now, imagine an individual with an alcohol use disorder who's trying to stay abstinent. It's been a long day at the office. They walk past the neighborhood bar and see the neon lit sign, smell the smell of alcohol coming from the door. Will they go in or will they go home? So these are just two of the many kinds of decisions we face every day. And we've all had the experience of having a decision that was not so good. So decisions impact our daily activities, and they have a really large impact on our health and our well-being. One of the major factors that affects many of our daily decisions is the neurochemical dopamine. And this is its chemical structure here on this little heart. And so dopamine isn't the famous love juice or pleasure juice that makes you feel good. Dopamine, in fact, does something even more interesting. It helps you learn about the situations and signals for the things that make you feel good. So when you make a choice that brings you pleasure, dopamine changes your brain to make you more likely to repeat that choice in the future. And this is a good thing. It helps us react appropriately to situations that can have beneficial outcomes. But there also are cases where this same system contributes to decisions that lead to negative outcomes. And addiction is one important psychiatric disorder where this is the case. The CDC tells us that in the years from 1999 to 2017, there have been 700,000 deaths in the US from drug overdose, a horrifying statistic. We're now at 70,000 OD deaths per year. So if we add up the numbers for 2018 and make an estimate for this year, our 10-year total is really basically equivalent to the entire population of this city of San Francisco. So truly, truly horrifying. So the problem now, if we look at it from the perspective of brain function, is that every time a drug user makes the choice to use drug, the drug actually activates directly the dopamine system in the brain, making the individual more likely to repeat that choice. As you can imagine, this is a horrible thing for the addiction. So addiction clinicians struggle to help people with this disorder, and we have some treatments that work for some people, but unfortunately not for enough people. So the numbers of the afflicted overall really barely budge. So this is a major problem for our society. How can we do better to help people with this issue? So what we would like to do is understand better what's happening in the brain during decision-making processes. We know that dopamine can impact decisions, but we really don't have this mechanistic understanding of how that works. So that's what my lab is interested in at Hopkins. So in proof of concept studies in the lab, we've shown that direct activation of dopamine neurons can cause rats to potently reproduce an action over and over again. In this case, the action is just pressing a lever. But this study and similar types of studies show that dopamine can powerfully shape behavior. So dopamine, when it's released in the brain, courses through the brain, rewiring neural circuits and affecting later choices. We also know from experiments then when subjects are considering different options, making decisions about what to do, that there are different brain states or patterns of neural activity that can be detected. I'm showing them here in these highlighted regions in these images from a human brain. So the highlighted regions really represent networks of interconnected neurons that are co-activated together. And we can measure these networks of active neurons in the brain of animals in the lab. And each network that's activated corresponds to a different choice. So we can now take these two ideas, these experimental observations, and put them together to address new hypotheses. And so what we would like to do is pair our ability to analyze brain states and our ability to activate dopamine systems in the brain and see if we can impact decision making. So I'll give you an example of how that might work in the lab. So we would seek to measure neural activity patterns when subjects are deciding between options, and then activate brain dopamine systems when we decode the brain state for option 1, but not option 2. So our goal is to strengthen the network that underlies option 1. And so in this way, we can see if dopamine can help us shift the likelihood that the subject will choose option 1 later in the future. So this is an idea, a picture of how we do these kinds of experiments in the lab to get a more mechanistic understanding of what's going on in the brain when we're making decisions and how does dopamine impact or bias our decision making. So you might wonder, how can we possibly translate things like this to humans? How can we eventually get back to helping the patients that we were talking about earlier? So one way in the future we might do this is use advances in neurotechnologies to interface with the brain and adapt the kinds of approaches that I described. So what we would like to do is increase the likelihood that subjects would make good choices rather than poor choices. This might sound like science fiction, but it's actually the case in medicine that we use neurostimulation, electrodes in the brain, sometimes to treat intractable depression, and very commonly to reduce the symptomology of Parkinson's disease. So what might this look like in the future for an addict who chooses to have either wearable or implantable neurodetection devices to read their brain states? The neural implants, for example, might detect a brain state that's predictive of a poor choice and suppress that state to reduce the likelihood that individuals will make that decision, or vice versa. Detection of positive brain states might lead to brain stimulation to strengthen that state. So you can imagine the positive impact we could have on patients where poor decision-making is at the heart of their psychiatric disorder. But we're not really there yet. We're not at the place where we can actually start treating patients in this way. We still have a lot of work ahead of us. We need many more years and months or years, see, it depends on how fast we go or how much funding we get, to test these ideas in the lab and to refine our hypotheses and our approaches before we then move to humans. For humans, we need continued advancement in neurotechnologies that interface directly with the brain so we can measure brain activity and stimulate the brain, eventually, hopefully, all non-invasively. And as you can imagine, this is a very large undertaking. So by its nature, it's a collaborative endeavor. So it will require neuroscientists, engineers, computer scientists, and physicians. And I feel really lucky to be a part of the Hopkins enterprise and to be here as a BDP across the Krieger School and the School of Medicine, because Hopkins has this interdisciplinary expertise in its faculty across all its many schools. And even more significantly, there's a strong collaborative spirit, a spirit of innovation. We heard about that before when we were talking about tech ventures. And you really need that kind of spirit to tackle a problem like this. I do know that the idea of using neurotechnology to change behavior is something we have to think carefully about, especially about constraints on its use. But I ask you to consider it because we really need to think of new approaches to help people whose disorders are intractable and even deadly, such as the case of opioid addiction. Because the truth is, for large numbers of people, the treatments we have currently just aren't cutting it. So if I leave you with one thought today, it would be that we change our thinking around disorders like addiction and open our minds to the possibility of new approaches that we can use to improve decision-making in patients. Thanks very much.